Welcome to the CJASN podcast. My name is Moumita Barua from the University of Toronto in Toronto, Canada. On behalf of my co-authors, I will discuss our paper entitled Integration of Genetic Testing and Pathology for the Diagnosis of Adults with FSGS that will appear in an upcoming issue of CJASN. FSGS is a pathologic lesion that is clinically used as a diagnosis but does not tell us about its cause. Appropriate therapeutic management is often challenged by our inability to define the underlying etiology, especially genetic causes. The literature tells us that up to 50% of patients with FSGS will not respond to prednisone and other immunosuppressive agents. Carl Tryggvason's seminal discovery of nephrin in 1998 led to a series of studies that identified a number of genetic causes in FSGS and nephrotic syndrome. Currently, there are over 60 genes that have been implicated in the pathogenesis of FSGS, mainly in children and in individuals with a family history of kidney disease. So we asked the following question: do mutation in genes implicated in hereditary FSGS contribute to the development of disease in adults? To answer this question, we leveraged longitudinal clinical data captured in the Toronto Glomerulonephritis Registry that is linked to DNA samples in the hereditary kidney disease biorepository. We were able to perform whole exome sequencing in 193 adults with familial and sporadic disease, which allowed us to interrogate the coding region of genes that have been implicated in hereditary FSGS. While we focused on genes implicated in hereditary FSGS, we also looked at genes shown to be causative for congenital abnormalities of the kidney and urinary tract, or also known as CACUT, which contribute to secondary FSGS. In total, we evaluated the coding region of 109 genes. 65% of the cohort had ancestry from Europe, 4% from Africa, 12% from East Asia, and 19% were admixed. The mean age of disease onset was 34 years. 49% of individuals developed kidney failure at a mean age of 47 years. We identified a pathogenic variant in 28% of families and 8% of sporadic cases. Overall, we were able to identify a pathogenic variant in 11% of the cohort. Surprisingly, a little more than half of pathogenic variants were found in the type 4 collagen genes, specifically collagen 4 alpha 3, collagen 4 alpha 4, and collagen 4 alpha 5 genes, but dominated by variants in collagen 4 alpha 5. This was an interesting observation because traditionally type 4 collagen mutations are associated with Alport syndrome. We found pathogenic variants in collagen 4 alpha 5 in an equal proportion of male and female cases, despite the fact that collagen 4 alpha 5 is X-linked. For the remainder of the pathogenic variants, 40% were found in genes expressed in podocytes and 5% were in genes that contribute to CACUT. Patients with pathogenic variants in podocyte genes or causative for CACUT had an earlier age of disease onset and kidney failure than individuals with pathogenic variants in collagen 4A. For example, the average age at which kidney failure developed in individuals with pathogenic variants in collagen 4 alpha 5 was 58 years, much later than what has been reported in the literature for Alport syndrome. This may be due to the fact that we identified a number of females with deleterious collagen 4 alpha 5 variants influencing a milder clinical course. Glomerular basement membrane abnormalities were more commonly noted in individuals with a pathogenic variant in collagen 4 alpha genes. We additionally identified a number of nonsense, frameshift, or canonical splice site variants in our cohort. These variants were labeled as likely pathogenic and were found in 9% of the overall group. Once again, a significant proportion of these were identified in one of the collagen 4 genes. When we examined the kidney biopsies in this group, we noted glomerular basement membrane abnormalities, suggesting that while these variants were labeled as likely pathogenic, they in fact may be causative. In summary, we used an expanded gene panel based on podocyte and CACUT genes to examine a large cohort of subjects with adult onset FSGS. Our surprising finding was the common identification of pathogenic variants in collagen 4A genes. Our findings also suggest that careful inspection of the glomerular basement membrane may hint at the involvement in these genes in cases that may otherwise appear idiopathic.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.